Measure Twice, Cut Once is a short form video series brought to you by the Collaborative Family Healthcare Association.
My name is Matt McClett. I'm the VP of Clinical Operations at NeuroFlow.
Hugh Barragan, I'm the CTO and co-founder at Mira, and we are a collaborative care technology platform.
I'm Dave Haddock. I was the CEO of Psyche Analytics for almost 10 years.
So traditionally, measurement-based care has been done in things like call centers where people are actually reaching out on the phone. And in today's day and age, that doesn't work anymore. People don't pick up their phone to complete a PHQ-9, right? We need technology to be able to do this and extend the practice outside of the four walls. So we can do measurement remotely and we can do it safely, not just thinking about depression and anxiety, but more and more thinking about things like suicide. How do we actually predict and identify these things remotely outside of clinic systems and then report that back to care teams? And that's really what's important here, is to not just collect this information, but also making sure that it's landing and getting into the areas where it needs to live to support providers.
Time a healthcare provider is doing something rote that a technology system could do, that's time that they're not providing the high impact parts of clinical care. So if a care manager is going to have to remember to send out assessments or to sit down with them and scribe out answers, something that a technology system could be doing, then they could be doing something more useful at that time, reviewing sleep hygiene protocols, talking directly to the patient. So every time that you're looking for something that a clinician is doing that is rote, think about replacing it with a technology system that enables everyone to practice at the top of their license.
Once we have learned how to collect the data, we're obviously using some form of technology. And the data that we need to work with in huge, vast quantities can only be analyzed with computers. We see patients in all manner of different sites. We collect data in different silos. We have to connect treatment information between providers, departments, institutions, and even countries in order to have optimal care. You may not see the issues patients have at home, and if you don't know what those are, you are perhaps making unnecessary tests, unnecessary demands on patients, creating unnecessary costs that postpone the successful outcome. And then we have to put it together with medical data and the medical outcomes so that we see the whole picture.
Everyone can learn more about NeuroFlow by visiting our website, www.neuroflow.com. We're also all over socials, so you can check us out on LinkedIn, Instagram.
Mira.com, that's MIRAH.com.
Our technology is still described on www.psycheanalytics.com. You can also find me on LinkedIn.